I have a problem that's really painful. Floating kidney. Holy moly. It has fallen 8 centimeters and also twisted. Got this after a renal failure. All right. I feel the kidney pressure to my ribs. The doctors don't believe that it can hurt. Oh no, I disagree with that. But it hurts very much. Yeah. I am eating 70% raw and lots of fruit. No animal protein. Smart. All I can tell you, this is M-A-L-I-N. Malin? I can tell you, my dear one, absolutely. You don't want any proteins, no beans, grains, nothing. I would be total fruitarian. Total fruitarian. Make that 70, 100% right now. But here, think about this. Now, we know in renal failure, you either have genetic weaknesses, and then when you start doing proteins and the acid ash forming diets, that the world is what the world is into. Bye-bye kidneys and all this other sort of thing. So to rebuild that, you get into your fruit, you get into the alkaline side of chemistry. But also a floating kidney, that kind of, now remember that when things are acidic, you can initiate what's called the calcium buffering system. Many universities, we've even touched on it here. It's a very observable physical reaction when the body is having too much acids. You can see it, you can explain it through what, I'll use their terminology, osteoporosis, petechia, bruising easy, cramping, spider veins, your bigger varicose veins, aneurysms, hernias, prolapsing, spasticity, ballooning, pocketing. All these things highly, if not 100% suggestive of connective tissue weakness. Now, when you start initiating the calcium buffering system, that means that the body is in a defense mechanism. The body's too acidic, and we have to pull electrolyte to bring in to try to balance those acids. Well, it's easy to pick up calcium. It's the most abundant metal in the whole body. And so it'll pick that up. You will see those symptoms when that happens. So this can also make for floating kidneys and everything else, because if you think about this, the more acidic, because to have kidney failure or renal failure, you have to be extreme acidosis on top of genetic weaknesses. So when you look at all that and you turn that around, when you're acidic like that, that's when you can start losing connective tissue, and it's all through the pelvic area. It can hit the prostate, ovaries, uterus, cervix, just everywhere in that area. Because when the kidneys aren't filtering, the whole lymphatic system is up for grabs, particularly on that side of the body, of course. So that's where, you can see it. So, and I'm going after your case here, I'm going after the parathyroid gland. I don't know about your pituitary. Remember, grit the eyes and look at your eyes. But I would be looking at pituitary just in case. You have to hit that little baby, but you want the parathyroid glands at the same time. And you want to clean out the bowel structure and everything else. There's that connection, right? The embryonic connection, we'll call it. So those are the things that I would be doing. Anything to strengthen tissue. But to strengthen tissue or cells, you can't be on the acid side of chemistry, because the acid side of chemistry is a corrosive side. So interstitially, as you begin this agglomeration from a lack of kidney filtration, that's when you see best is to call it interstitial acidosis. They call it now interstitial cystitis, and they got all kinds of names that are related to that, but the bottom line is, interstitially, your lymphatic system has become stagnant. And since the lymphatic system comprises 80% of interstitial fluid, that's a problem. That's a problem. A serious problem. Because where's the blowback? Eventually, on the cell themselves. See, on the outside of the cell, we're still in the inflammatory process. But intracellular acidosis, that's when you start breaking down. As we said, the organelles are all the mitochondria, whatever tissues that the blowback hits. No sugar, no gluten, no coffee. Smart. My histamine sensitivity is gone, which also gave me lots of problems before. Is there anything, but remember, histamine is a what? An immune response. To what? Proteins. Or you could call it acids, proteins. Is there anything I can do? I'm suffering very much. Also big problems with bladder. I figured that. ACC by this. Absolutely. It might take a while to fix things. Some of you guys have some things that can take a little while to fix them, but you want to be on the road to fixing them. Don't get too upset if it takes a little while. The more raw you do, the more it pulls the pain out. The more cooked you do, the more it sets you up for pain. If you notice that when you increase energy levels to tissues, the pain goes away, the tissues become strong. I mean, it's really neat to see. So you know in a weakened state, well then you ask yourself, what weakens your state? Diseases? They don't exist. So what weakens your state? How about your lifestyle? How about the chemistry that you're interfacing with in life? We know that if you breathe toxic chemistry, acids, you have a good chance of passing. Or whatever. Burning and everything else. So what about if all the acids from each cell in your body, say, let's just say we have 100 trillion cells, because no one really has defined that, in my opinion, because when I look, it was 50 trillion when I went to school, but then about 15, 20 years ago it came up to 78 trillion, and then, but imagine each cell poops. Each cell poops. You have to look at each cell like your little baby that you just brought home from the hospital. You got to feed it and you got to clean it. And if you don't clean it, that's when you have the acid blue. You see all the inflammation on the bottom and everything, all the redness and stuff. Yeah. And that should be in people's faces, that urine should be acidic because that's your metabolic waste, and that you never want to keep urine or anything else inside or on the skin. Because remember, acids, you'll see them. Acids are reddening, inflammatory, heat producing, all of those things. And there's only one system in your body that deals with this. You only have two systems really that deal with the integrity of a cell. The blood and lymph. Those are the two systems that are responsible for, one, feeding and bringing energetics to a cell, but equally as important is removing the metabolitic waste from that, the waste from the processing of this chemistry. And there's waste at all levels during the processing of this chemistry, because there's all types of cycles, from the cribs to everything you can imagine. Even the methylations, all these cycles that are out there. And of course, in those chemical spin-offs are acids. So that's what I would be doing if I was you. I would move to 100% fruit, berry, and melon diet. I would head off with herbs for the kidneys. I would head off, you could do some antispasmodic and some pain and see if that'll help. But bottom line is getting this kidney to regenerate and getting that acid out of the kidney itself. Also strengthening connective tissue and strengthening tendons and everything else. Muscles in the body, everything like that.